None of us want our ski vacation cut short by an injury. The Steadman Hawkins Clinic has a team of physicians who specialize not only in treating injuries, but also in preventing them.
My name is Tom Hackett. I'm an orthopedic surgeon with the Steadman Hawkins Clinic and the team physician for the United States Snowboard Team. It's funny, the first year I worked here, I was so busy taking care of patients. I skied more in Japan than I skied in Vail, even though I was living on the mountain. But now I get out absolutely as much as I can. I oftentimes will hike the mountain early in the morning and try to take at least one run down before I start my day. I'm a huge fan of getting into the trees and off the beaten path a little bit. Skiing or snowboarding or even telemarking sometimes. But on average, snowboarders have more injuries with their wrists and arms and upper extremity, whereas skiers more commonly have injuries in their lower extremities and in their knees and tibias. Amateurs have probably some more wrist injuries, whereas the professional snowboarders and the riders that are really at the very highest level tend to get injuries sort of head to toe. So, but in general, it's more hand and wrist injuries in snowboarders and leg and knee injuries in skiers. Obviously, I'm a scientist and a surgeon, so I always look for data, and there's a number of studies looking at the efficacy or the success rate of preventing injuries with wrist guards. And there are some studies to sort of support that, and other studies don't necessarily support that. So what I'm saying is it's a little debatable about whether they help or not, but as someone who counts on his hands for his living, I tell you what, I wear them a lot myself. So I think that they can be useful for some riders, especially more beginners. Probably it's a good idea. I think there's a couple things, and we've done some studies on this at the Steadman Hawkins Clinic, and really doing some strengthening and conditioning long before you ever get on the slopes is by far the most important thing. One of the more common injuries in skiers is an anterior cruciate ligament tear and ACL tear, and by strengthening your hamstring muscles and some of the other muscles on the back of your leg, you can help to prevent that. We've also learned by looking at statistics that people are typically hurt more towards the end of the day and also more towards the end of their vacation. So we try to tell people that taking a rest day towards their vacation is a wise thing to do, and that if it's at 3 or 4 o'clock in the afternoon and you're thinking about just taking one more run, you might want to think twice about that, because statistically people tend to get hurt at the end of the day. Unfortunately, if you're in the situation where you're hurt on the hill, just trust the ski patrollers that come down. I've had the opportunity to travel around the world and work on different ski areas and different ski mountains, and I'm confident that the ski patrollers we have here are by far the best in the world, and I would trust them with my life. And so in the unfortunate incident that you do get hurt, just be thankful you're in a good place, and the patrollers will take care of you, and when you get to the bottom of the hill, the rest of us will take it from there.